Welcome to the second episode of Advancing Ocular Health, a podcast mini-series in which ophthalmologists and optometrists discuss the latest innovations in eye care pharmaceuticals. Today, Dr. Francis Ma from Scripps Clinic in La Jolla, California, and Dr. Mile Brujic from the Premier Vision Group in Northwest Ohio have a conversation about TobraDex ST, a new formulation of the steroid TobraDex that will find use in the ophthalmology office and the optometry office. Let's get started.
Hi, I'm Dr. Mile Brujic. I'm a private practitioner and a part owner of Premier Vision Group, which is a 3-location practice in Northwest Ohio. Been practicing for 18 years, and during that whole time, I've really seen the value of the collaboration between the optometrist and the ophthalmologist. And with that said, I have a rock star with me today, Dr. Francis Ma. Dr. Ma, if you could briefly you don't need the introduction, but if you could, please give everybody a little bit of a background on yourself.
Sure, Emile. So I'm Francis Ma. Right now I'm at Scripps Clinic in La Jolla, California. I'm the director of the cornea service here. I've been practicing for 20 years. Was at University of Pittsburgh for 17, where I did my residency fellowship in cornea external disease refractive surgery, and then was the director of the cornea service there for 12 years. Moved over to La Jolla from Pittsburgh because my wife was a little smarter than me, wondering why we had to live in Pittsburgh. So it's been a great 8 years. And my situation is kind of a hybrid between academics and private practice. So, just like, yourself have seen a lot and experienced a lot in terms of, pharmaceuticals and the management of ocular surface disease and inflammation and so forth. So I'm happy to be here and, excited to talk about this with you. I've been hearing a lot of great things and, excited to have this discussion with you.
I agree, and I think we both thank Eyevance for really kind of bringing us together here in this podcast series. I think this is going to be interesting because their commitment is really sharing information, and they're really advancing the way that we think about ocular surface health in particular. And today, what we're really going to focus on is TobraDex ST and really its role in how we manage more advancing ocular surface conditions.
Yeah, no, I agree. I think Eyevance has taken a really unique aspect, looking strictly at anterior segment, conditions. And, TobraDex has been around forever. And I think Eyevance did a great job by, acquiring TobraDex ST, with the XanGen technology. And, I'm excited to talk about this. So maybe you can start us off and talk about some of the indications and some of the usages.
Yeah, I think that's a good place to start because I think whenever you're talking about pharmaceuticals, it always is good to take a step back to reassess really what the indications are and what the medication is. So TobraDex ST, really the active ingredients are two things. One, an antibiotic, tobramycin, and dexamethasone. And what's interesting is they actually reduced the concentration of dexamethasone from 0.1% to 0.05% in this formulation while maintaining the 0.3% of tobramycin. And what this is really kind of in what it's available for us for is for the treatment of responsive inflammatory ocular conditions, things for which corticosteroids, we would use, and also to more superficial bacterial ocular infections, or if there's this risk of bacterial ocular infections. But with all of that said, and with that indication, I think we do have to be cognizant of the adverse events. And Dr. Ma, could you take us through some of those considerations? Because I think it is important with any medication, when we understand what the benefits are, we also have to balance that with what some of the risks are as well, too.
Yeah, absolutely. Every single medication that we use in clinical medicine is going to have pluses and minuses. And as you know, and everybody listening knows, where it's a balance. Try to maximize the benefits and minimize the issues and the adverse reactions. So just some of the things to consider with TobraDex ST. One is just tobramycin and aminoglycosides in general. There are patients that are hypersensitive to it. Typically, if they are, that have like kind of a localized toxicity, maybe some eye pain or pruritus or edema of their eyelids or conjunctiva. And then, there's the other component, which is the dexamethasone, which is a very strong steroid. Even though it is reduced in concentration, we still have to worry about some of the issues with corticosteroids, such as an increase in intraocular pressure, which could happen in a percentage of patients, which could lead to the development of glaucoma. Sometimes you can get subcapsular cataracts. You can get impaired healing, which again are all issues from potential complications from the steroid that's involved here. So it has to be, judged and used judiciously. Other issues could be the development of secondary infections. For example, fungal infections, bacterial ocular infections could be increased due to the suppression of the host immune response. And there's also some other very small non-ocular adverse events, which always seem to happen in topical drop steroids and antibiotic studies, such as headaches and increased blood pressure. Maybe, Mila, you can talk about some of the common usages and then the dosing that we use with TobraDex ST nowadays.
Yeah, so it's interesting with all the adverse events. This is a well-established platform. We're familiar with tobramycin, we're familiar with dexamethasone, so we're fortunate that we experience these adverse events at relatively speaking pretty low levels, and that makes me feel good when we're utilizing it for some of the more kind of common anterior segment diseases that we manage all the time. Blepharitis specifically, meibomian gland dysfunction, bacterial conjunctivitis, and even to those contact lens related red eyes, the ones that are inflammatory in nature, where we're concerned that there may be some type of underlying infectious etiology as well. It gives us really this nice cover where we're providing antibacterial effect in addition to that corticosteroid as well too, and the anti-inflammatory components associated with that. Now, the way that this is approved, this medication, is we can utilize it as frequent as 1 drop every 2 hours for the first 24 to 48 hours, and then 1 drop every 4 to 6 hours administered after that. I will tell you that practically speaking, I don't feel the need or the necessity to really frequently go that much, but we know that we have that and we have the ability to do that, and it has the FDA approval for that kind of higher dosing during those first 2 days if we need it. Now, I think what's interesting with this is really the difference between this and traditional TobraDex. And Dr. Ma, if you could help crystallize this just a little bit here before we kind of move on, because I do think it's important to formulate the basis on what really creates the difference between these two formulas.
Yeah, I completely agree with you. I think a lot of people will hear TobraDex ST and they'll think, oh, this is just a version of TobraDex that happens to be branded. Maybe it's some type of a line extension or something like that. But there really is a lot of thought that went into the development and the formulation of TobraDex ST, just as you've alluded to. Number one, and you've already spoken to it, is the decreased steroid concentration from 0.1% down to 0.05%. We all know that dexamethasone is a very strong steroid. It's actually 10 times stronger than prednisolone. And so, decreasing that very strong steroid down to 0.05%, I think was a very interesting, concept to try to reduce some of the adverse events or toxicity that potentially could come from that. Another very important formulation enhancement is this XanGen suspension technology. And what this XanGen suspension technology is xanthine gum was added to the formulation, and it stabilizes the fixed dose combination. So it really increases the viscosity, therefore increasing the contact time on the eye. It also, as we'll hear in a little bit, it really helps with keeping that suspension in the mix, if you will, for a lot longer, so that it does not fall out of kind of that optimal mix for topical use. So even though I've spoken about the XanGen technology and what it's supposed to be doing, maybe Dr. Brujic, Mile, maybe you can talk about the Scoper study, which really tells us about the differences, kind of in an experimental model, as far as the advantages of XanGen.
Our program will continue after a short break. This podcast is brought to you by Eyevance Pharmaceuticals. At Eyevance, we're advancing ocular health by investing in vision through ophthalmic therapies. Our mission is to ensure optimal vision and better quality of life for all patients. To learn more, visit eyevance.com. That's EYEVANCE.com.
I think the Scoper study really kind of emulates the formulation and some of the benefits from a compliance perspective. It's interesting though, you really hit on everything that I was thinking about when I think about this technology. The one thing that's interesting though is from a clinical perspective, whenever we hear increased viscosity, we always assume it means blur or increased blur profile. But it's not that way with this technology, meaning that even though the viscosity is increased, you place it on the eye and the patient doesn't have to worry about sustained blur. So again, the way it's engineered is such that it increases retention time but doesn't necessarily blur the patient. The other interesting thing is that the concentration of dexamethasone is cut in half. Normally, when we think about increasing tissue penetration, logic would just kind of tell us to increase the concentration of the active ingredient, when in actuality, this technology did the exact reverse because of the way that they retained the medication on the surface of the eye. Now, the Scoper study, this is interesting because what they did was they looked at formulations of TobraDex ST, so what we're really communicating right now, or about right now, and then just TobraDex. And these two formulations were both vigorously shaken for about 10 to 15 seconds. And they were actually placed in graduated cylinders. Now, what's interesting is researchers actually left them in these graduated cylinders after they were shaken, because we know when something's shaken that there's a more even distribution of medication throughout that bottle. And we know that, or logic would tell us that as it sits, there's more medication that will just gradually decrease, or there will be less active medication towards the top of whatever container we're measuring it out of. Well, they sampled the top portions of these graduated cylinders at various time points. And what's remarkable to me is that 24 hours after they shook these medications, not surprisingly, when you just look at standard TobraDex, in the top 10 millimeters of this 40 mil graduated cylinder, there was only 39% of the active medication. When you did the same thing and tested the top of the TobraDex ST, it was at 97%. So what that simply tells me is that the medication is physically staying evenly distributed throughout this graduated cylinder, and we expect the same thing to occur in the bottle. This is part of the story, though. I mean, this XanGen technology not only stabilizes it within the bottle, but it actually acts as increasing retention time on the surface of the eye. And Dr. Ma, I'd love to hear your perspective on this. In particular, from a surgeon's perspective as well, too. I'd love to hear the importance of what this really means to you.
Yeah, I think you hit the nail on the head. I think there's a couple of different aspects which are really beneficial for the XanGen technology. Number one is dose for dose. You're going to get very consistent drug on the eye, and that's very important at the beginning of the therapy all the way to the conclusion of therapy. You're not going to get a very, very dilute concentration of the drug in the beginning and then a highly concentrated drug at the end, like you might with some of the suspensions. This is really going to provide, again, dose for dose consistency, which is very, very important when you're talking about the various conditions that we're trying to manage here. What do you think about the settling rates in your practice? How do you think that benefits your patients?
What's amazing is, again, this settling of medication, if they're using the traditional technology and they don't shake it, they're not getting a high concentration of that medication early on. So there's just a level of clinical security that they're getting what we actually prescribe for them.
I know you're absolutely right. So the other aspect that is unique in the XanGen technology is how it helps to actually strengthen the efficacy of the tobramycin. So as you had mentioned earlier, tobramycin is actually the same concentration in TobraDex and TobraDex ST. However, the XanGen technology really increases that concentration. They did some rabbit studies. They also have done human studies, which you'll hear about later. But in the rabbit studies, the tobramycin concentration in the rabbit tears were more than 8 times higher with TobraDex ST at 10 minutes versus just the regular TobraDex.
I mean, this really shows the power of that technology. 8.3 times the concentration in tissues. I mean, being treated the exact same way, just simply utilizing a different vehicle. I think that's really where the difference resides here.
Yeah, no, I completely agree. And then that translates to this bactericidal activity actually increasing. It's really great science that's been done. They looked at TobraDex XT, they looked at TobraDex, and then they looked at various different strains of antibiotics, which are very important in the care of our patients in ophthalmology and optometry. They looked at Streptococcus pneumoniae, then they also looked at methicillin and tobramycin resistant strains of Staph aureus. And what they were able to show is that in the tear film with strep pneumo, treated with TobraDex ST, it took 5 minutes to kill 99.9%, whereas it took 120 minutes to see a 3 log reduction in the strep pneumo CFUs and tear films that were treated with the regular TobraDex without the XanGen technology. And then for the MRSA, tobramycin resistant strains of Staphylococcus aureus, similar, very surprising results. And those were the TobraDex ST were able to reduce the Staph aureus, MRSA, and tobramycin resistant strains 5 logs, which is greater than 99.9%. So it's really impressive that the TobraDex couldn't even kill it.
So it's interesting, the information and the data that you just reviewed, Dr. Ma, because you can see, and we know that tobramycin is an effective antibiotic, and we know that if it resides within bacteria at a high concentration for a given period of time, it works tremendously effective. The challenge with traditional vehicles is that it just dissipates off of the eye too quickly. With TobraDex ST and this XanGen technology, it allows it to retain on the surface of the eye. I mean, personally, when I'm prescribing something, it just gives me that security that I know that we're covered. So we know that if we're suspecting any type of bacterial overpopulation or infection, we know that we can cover that with this technology, and we know that it's going to be at high concentrations, and we know that it's going to be effective at some of the most common strains that we see in eye care. Um, I would like to hear your perspective on some of the pharmacokinetic data, especially things like anterior chamber concentrations of the medication and what that really means for you.
Yeah, that's an excellent point. Because we're not really treating rabbits, are we, on a daily basis? I alluded to the fact that there is human pharmacokinetic clinical data as well. And again, half of the dexamethasone showed very similar ocular tissue exposure, which I think is very comforting to us. So we're going to get the same amount of drug in the tissue. However, we're going to get, we're going to have lower concentrations in the bottle. There was a human pharmacokinetic study, and what it showed was the ratio of the mean dexamethasone concentration in the aqueous humor of patients receiving TobraDex ST to patients receiving TobraDex was 1.17 at 1 hour. So again, it was very similar ratios of TobraDex ST and TobraDex. So again, you're going to get that comfort of knowing that you're getting that anti-inflammatory concentration at the same tissues levels, even though you've cut the total amount of dexamethasone in half. So I think that's very impressive. What do you take that study and how do you assess for your patients that type of information?
Well, I think it's telling, and I enjoy this type of data just because I think it's part of my biochemistry background. I've always enjoyed understanding pharmaceuticals and how they interact with tissues, how pharmaceuticals can be changed, manipulated, modified to actually enhance activity. And I like the direction that all of this is going with all of the data that we've reviewed so far. But personally, if it doesn't result in some type of clinical benefits, then it's good academic discussion, but it's not necessarily something that's going to translate into better clinical outcomes. I'll share with you that, I mean, there's good studies to show that this does show benefits, and there are things where you see that this performs. There was a randomized multi-center investigator masked active control parallel group trial conducted in adult patients who had moderate to severe blepharitis or blepharoconjunctivitis. Patients were treated with TobraDex ST, and after 1 week of dosing, had a significant reduction in a lot of the signs and symptoms that we typically are looking for in these patients. Certainly, lid margin redness was one thing that was reduced, ocular discharge, bulbar conjunctival redness, lid swelling, itchy eyes by the patient, and also gritty eyes. I'll share with you practically what we've heard from patients is they're responding relatively rapidly when we start them on TobraDex. So it's very consistent with what the trials actually show in these individuals and in these patients. Dr. Ma, anything to add about that in your clinical experience?
No, I completely agree. With your assessment. Um, I think the speed of the relief of the symptoms is exactly what we need because that's what the patients are coming, to us for. So I completely agree.
I think that's so important. Um, in particular in the era that we're in right now where we're really looking for more efficient ways to deliver eye care. We're looking for treatments that are going to deliver essentially the best bang for the buck, and for us that means the quickest acting agents, and one of those things that we look at is blepharitis. I mean, this is one of the most common conditions that we see in our practices, and it's interesting. We've really aggressively incorporated this into our clinical protocol. So what we'll do is, as soon as we identify blepharitis, either anterior or posterior, which again oftentimes are delineated academically, but again you rarely see one without the other. I think it's just a great option, and then we'll usually have these people back after treating them with TobraDex ST for a week for a microblepharoexfoliation treatment, which by that point, a lot of the signs and symptoms have reduced. The eyelid margin is just much more quiet, and the bacterial population is just so low that it's much easier to treat those patients as well too. Dr. Ma, do you use it for any type of anterior conditions, like specifically? Do you see a role for this with meibomian gland dysfunction?
Yeah, I really do, Mile. So as far as meibomian gland dysfunction, obviously it's not going to be as inflamed in terms of the eyelids as blepharitis, but there definitely is inflammation in meibomian gland dysfunction. Typically, what I'll do is I'll explain to the patients that the meibomian glands produce an oil, which is supposed to be the viscosity of kind of like an olive oil, but it's become thicker. If it's very thick, it's more like butter that's solid in the refrigerator. And so that can be very inflammatory in nature. It can also increase the amount of bacteria that are around that are just colonizing that thicker viscous oil. And so obviously with TobraDex ST, a combination medication is sometimes the perfect ticket for these patients because you're going to reduce that inflammation. You're going to eradicate, knock down a lot of that normal flora bacteria that's around. So I think it's really an excellent, potential therapy for these patients. Same thing with bacterial conjunctivitis. What do you think about bacterial conjunctivitis, Mile?
Just to add quickly to meibomian gland dysfunction, we know that it's very delineated. There's obvious and non-obvious meibomian gland dysfunction. Obvious being that one that we think is much more deep-rooted in inflammation. So I'm with you. I think that this is just a super initial treatment for these patients where we can then work on more advanced procedures after that. Again, a clean lid is really the way you need to start. But bacterial conjunctivitis is really interesting. With this profile, in particular with the antibacterial activity that you discussed earlier, the tissue penetration, the concentrations getting so high, and the ability for it to kill a lot of these microbes, I'm very comfortable prescribing this in a scenario where we have bacterial conjunctivitis, where you don't necessarily usually think of a topical corticosteroid. This is just a logical conclusion for us to prescribe this. Why? Because we have high antibacterial activity, but then, like we were talking about earlier, you can sequester a lot of those symptoms very, very quickly as well. So you're reducing inflammation while you also have strong levels of antibacterial effect as well.
Our program will continue after a short break. This podcast is brought to you by Eyevance Pharmaceuticals. At Eyevance, we're advancing ocular health by investing in vision through ophthalmic therapies. Our mission is to ensure optimal vision and better quality of life for all patients. To learn more, visit eyevance.com. That's EYEVANCE.com.
Dr. Ma, do you see contact lens complications in your practice?
So I do. As a cornea specialist, most of the times it's limbal stem cell issues from people that have just abused their contact lenses, really caused a lot of hypoxia, and steroids are a great option there. Obviously, a lot of people will have some keratitis as well, but I think there's a much more common condition that's associated with contact lens wear, and that's glare. Maybe you can kind of talk us through your management for glare and specifically how TobraDex ST might be useful in these patients.
Yeah, so I saw unfortunately two of these this morning, but that fortunately benefited from some of the therapies that we have available, i.e. TobraDex ST. So um, when you're looking at the contact lens acute red eye, you're really looking at a condition that is inflammatory in nature, and it can arise from several reasons, but oftentimes sleeping in lenses causing a either infectious red eye or a non-infectious red eye that's more inflammatory in nature. Regardless, you have inflammation and you have the risk of some type of bacterial infection. So this just really is a logical route. And the good thing is that removal of the lenses, treating them with this drop, we see virtually 100% resolution. We'll usually see them back in 3 or 4 days, and most of these patients are 100% symptomless at that point. So it makes a really, really logical approach to treating these conditions.
Yeah, I think that falls right in line. The conditions that we talked about, are on label, right? They're the treatment of steroid responsive inflammatory ocular conditions for which a corticosteroid is indicated and where superficial bacterial ocular infections or a risk of bacterial ocular infections exist. So maybe, Mila, you can kind of talk to us a little bit about some of the ST differences. We'll kind of summarize some of these things.
So as we dive into the weeds on all this, Dr. Ma, I think it is important, just like you said, to step back and kind of re-summarize everything, because we know antibiotic steroid combinations work and they work well. So what makes TobraDex ST a little bit different? What makes it unique? Well, certainly, first and foremost, we're going against logic here. You normally expect companies to increase the concentration of corticosteroids in their medication if they want higher concentrations in the tissue, where in this case they reduced it. They cut it in half because they knew the xanthan gum or the XanGen technology actually retains it on the surface of the eyes better. What's also interesting is with this XanGen, it actually keeps the TobraDex ST suspension like 97% suspended. So you know that the first drop that you're using out of the bottle has the same concentration of active ingredients as that last drop does without the need for shaking. And it has this wide use in optometry and ophthalmology for a lot of those kind of core conditions and common complaints that we're hearing from patients: blepharitis, obvious meibomian gland dysfunction, bacterial conjunctivitis, contact lens um, related acute red eyes, all of these things that are just simply being treated more efficiently because of increased retention time on the surface of the eye. And what's interesting is with all of this, I mean, it's more easily accessible with a lot of these, or with the copay card that Eyevance has put together.
Yeah, and I think, just a couple of other, kind of impactful things that I found out, about TobraDex ST. One, which you've talked about, which is, the suspension being, able to hold, itself 97% at 24 hours post shaking, which allows, that more consistent dosing, and then the greater and more rapid bactericidal activity, where even against the Staph aureus, that's tobramycin and methicillin resistant, it's going to be able to eradicate it and really reduce it pretty close to zero, 5 log reduction just in 10 minutes. I think those, aspects really impressed upon me. And, maybe you can go into a little bit more detail about how Eyevance provides the promotions to get access for these medications, because the medications are great, but if the patients can't get them, then they're of very little use.
You bring up such good points, and I think this data is pretty unbelievable to show that you have the same molecules, the same antibiotic, but you put them in different vehicles and they react completely different with some of these resistant antibiotic strains. So that just shows the level of efficacy and how important it is to really pay attention to the vehicles that these medications are actually placed in, because it makes massive differences that exist in the way that they perform when they're placed on the surface of the eye. But all of this means nothing if the patient can't access the medication, which is one of the things that I give kudos to Eyevance on. You mentioned it, but the copay assistance program, I think this really ensures to us, the eye care practitioner, that when we're prescribing the technology that we want to prescribe, the patients have a high chance of having access to that medication. And that really it's a kudos to Eyevance for really thinking this whole process through, not necessarily just delivering the technologies that we can actually utilize to treat our patients, but also following it through to those, and I think you can agree with me, sometimes the pain points of accessing medications, or patients getting access to those medications. They've kind of eliminated those barriers or reduced those barriers for us, again, with these copay assistance programs that allows patients to get these at a relatively low cost.
Yeah, no, it really is. And Eyevance, like you said, kudos to them for, making the new medications and the new formulations not only efficacious, but also, available, and giving patients access to these medications.
So, Dr. Ma, we've talked a lot about TobraDex ST. What's something that, for the listener, like something that you feel like this is a key takeaway with the discussion that we had about the technology?
Yeah, that's a great question, because we did talk about a lot of different things regarding TobraDex ST. I think two things for me. One was that TobraDex ST, and you mentioned this, showed a 97% suspension at 24 hours post shaking. I think that is really important, because, as you mentioned, it's going to really make their outcomes better, and it's going to simplify their management. So it allows a lot more consistent dosing. I think number two is, due to that XanGen technology, you've got longer retention time on the eye. And what this is going to do is it's going to translate to higher drug concentrations in the ocular tissues. You're going to have, we talked about the pharmacokinetic data for the dexamethasone, but you're also going to, as you mentioned, very critically, impact the bactericidal efficacy of the tobramycin, the exact same antibiotic, and yet it's much more potent in that formulation because of the longer retention time. What do you think, Mile? What are some of your kind of take home or takeaways from our discussion?
I think you're exactly right. They're assured that there's higher levels of antimicrobial activity because of the XanGen and the retention time on the surface of the eye. To put a bow on this technology, I think, one of the real benefits is the access component. I think this is becoming an increasing issue, and the copay assistance program really gives patients, both those that are non-Medicare insured patients and also the Medicare insured patients access to these technologies. So I think you really summed it up nice, and I think the copay assistance program just really finalizes this thing from a clinical perspective. Boy, Dr. Ma, I want to thank you for spending time with me today. This was fun, and your level of knowledge and your depth of kind of on these topics is just always great to talk to you. And I hope that for the listeners, you've kind of pulled a few key clinical pearls away, and also a little better understanding surrounding this technology and kind of what differentiates it, what makes it a little bit different from its predecessor.
Yeah, and I've had a great time with you, Mila, and it's been really fun talking about this great technology, and I'm really looking forward to everybody experiencing the XanGen and the new TobraDex ST.
Thanks all for listening.
Thank you for joining us on this episode of Advancing Ocular Health. Subscribe to the podcast on Apple Podcasts or wherever you stream your content. If you enjoyed the experience, leave us a review. If you missed our first episode on the ocular allergy drug Zerviate, you can go back and listen to it too. Join us next episode when we'll review the latest conversations around Flarex for anterior segment inflammation.